I already hit start. I'm hearing an echo. Who's got the echo going? What is that?
Look at this lineup. The elite.
The elite. The elite. Post that. Post that.
Do I look too dark? Shine some light on this.
Yes, sir.
Do you have a ring light?
Look like you're sitting in the dark.
I turned the lights down in the room for more vibey effect, but it looks kind of dark.
How you guys doing?
Let me go turn my lights on. You guys hang out.
It's giving your parents' basement. Brendan, so are you a new man after doing this oral board?
I'm a new man, freshly shaved. No. Yeah, new man. Great to be done with that thing.
Man. So did you have any high-profile examiners?
What do you mean high-profile examiners?
I don't know, like people who have published a lot, like intimidating type attendings.
Oh, I mean, wait a minute. Is that internal speakers, microphone? Yeah,
like Michael Block for implants?
It's one of you guys. I'm hearing an echo.
Is it me?
Amir, what was that point? Oh, Amir's signing out on the Sunday Bacon. So yeah, no, I mean, I honestly, I might have had some big published guys on the exam, but like I didn't know, I didn't recognize them. Everyone was pretty professional, nice. I think. I mean, I didn't get anything that was like. It seemed very fair, very smooth, not as challenging or like how does it say, like grueling as the practice tests and people that were doing the exams with me.
Yeah.
Wait, who just moved something? Something just got closer to the speaker, and now I'm hearing the echo a lot now.
Is it me?
I think it's you, Joe.
Joe, you got to put your phone in sideways. I feel like this happened last time.
Is that echo still there?
Yeah, it's echoing.
Let me go grab my my headphones. That might help.
Let's try that.
I feel like we didn't get through our list last time either. Like there's some topics that we didn't even get to. And since then, I think I've had some questions on clinical stuff. I had a weird day today though. So I teach at the University of Washington Dental School. All of us do in our practice. We volunteer teach there. So we do like a half day in our office, depending on which of the 4 locations we're at. And then we have to rush it down to Seattle, which is like, depending on which office, it could be like 25 miles away or 40 miles away. And then, so we get down there and then we have to park in a garage. They make us park like a quarter mile from the freaking dental school, and then walk outside to get to the dental school. We're doing this for free. We're volunteers, right? We don't get paid to teach there. And so like we do it out of our own time. We cut a half day out of our schedules to do it, but they don't really make it super accommodating for us. It's like, it's almost like, they moved our garage like a quarter mile away. And so like we have to walk. By the time I get down there, like no lunch, nothing. I'm just start teaching, It's a little bit, challenging sometimes.
Why do they do that?
It's one freaking car spot. Like one of us does it every Wednesday afternoon or so, right? We go down there for a half day, like 1 to 4. It's not even a full day. And we have one car spot that we would need in one of their dental school is in the hospital. So there's like tons of garages and places to park around there, but they don't let you. And so you have to get a pass for this one spot that right now it's like a quarter mile away. I know. So
Gallagher had something similar but they would make faculty park in that parking lot that's a half a mile away. Yeah. It's funny because it's like you're doing this for free. They need faculty members, and then they're gonna do you have to walk in the snow to get there too?
Well, today was like raining, and it just started hailing here now in Seattle, but yeah, it was raining and just windy, and it's right by the Bay Area a little bit, the Bay, and so there's some breeze from the water. But again, it's not. I mean, winter is pretty lame to be walking in and raining all the time. So, but yeah, it's not a huge problem. It's just annoying because I don't have much time to get down there, and now we got to park so far away that like by the time I get down there, they've already started almost pretty much. So it's like I don't have time to eat either. So it's like.
That is a huge problem. That's an absolutely huge problem. They should make it easier for you, and they should be paying you. They're not paying you. You should be able to park on the front stoop.
Yeah, they don't pay us. It's all
drive into the faculty.
We're a quote affiliate faculty. That's our title.
It'll just slap you in the face. Oh god, man. Hey, you know what? You're doing a great thing. Don't let these people. You wash. Let's call them out. Get this man a parking spot.
Nobody's watching. Well, actually, they probably some of the students probably are. It's funny. I was teaching today, and then when the classmates was like, one of the third years was like, "You look really familiar." And I'm like, "Oh, okay. Wait, are you on that one guy? This podcast that just graduated and is in practicing now?" I'm like, "Brendan?" He's like, "Yeah." I'm like, "Yeah, I was on his podcast." It's pretty funny.
Oh, sweet.
Yeah.
Can you guys hear me better?
You're sideways.
Joe.
It's served salt.
No, but, so what's going to happen is when the podcast is edited, you're going to be like framed to fit, and maybe half your face might be there when you're talking. Just telling you.
Right. Which
So,
half?
I don't know. Could just be the teeth.
Okay, I'll take it.
I still hear an echo.
You hear that, right? I got that too. I hear it.
Is that me? I don't know what I'm doing wrong, fellas. Hold on a second. Let me log off and log back in. How about that?
Why don't
I think you need a salad bowl antenna.
the audio to come out of your headphones and not the speakers? Because it might be using the
think it-
microphone from your headphones, but not the actual microphone or the speakers.
Okay, hold on.
Are you guys set up that way too?
The echo's gone, right?
Oh.
How about now?
No, you still got a little bit.
No.
of echo. Is anyone playing this on their speaker?
I am. I'll turn it down. Let's see.
Joe.
The volume. I play it on the speakers and hear it, but you'd be able to hear it. Is there still an echo? Well, he's off now. So
Is there an echo now?
I don't know. But so back to like teaching. Like I've been doing it for like 8 or 9 years now. So it's been a while.
Better? No? Damn.
where's your laptop?
How about now?
Can you sign out of the other place?
Sign out again? Okay.
No. The other one that the other place.
You two going on right now.
Oh, Lord have mercy. Okay, hold on a second.
I need a beer.
You guys working tomorrow?
I am.
You're not?
What time do you get up for work?
This morning I left the house at 7:30.
It's not bad.
I'm hearing an echo now too. What the heck? 7:30? That's not bad.
All right. I'm not sure what to do, guys. I don't have a laptop. Let me think.
Your phone
Let's
should
see.
be the best if you have it connected to earbuds or something.
That might be good. I'm not hearing anything right now.
Yeah? I mean, maybe it was just too far. I can just hold it right here. Here's what I had set up right here. It worked the last couple of times.
I just heard an echo.
Oh, man.
Are you holding it on the bottom? Because then the speaker might be like bouncing off your.
Yeah.
Try holding
No,
it.
I'm holding it sideways.
Do you have another set of headphones?
I really just have this set right here.
Try it with
Hold
it on
on.
again.
Brandon, what time do you get up for work?
Well, it's supposed to be 5:36.
How about that?
Today it's been.
Hold on. I've got another cell phone I'm going to try, guys. I'll be right back.
He's got a burner.
Yeah, now that raises a lot of eyebrows, Joe. Why do you got another cell phone?
This is Better Call Saul over here.
It should be between 5:30 and 6. I'm still coming off of like the boards, catching up on like just everything content and whatnot. So like today was like 6:30, 6:45. It's got to be.
That's like when I sleep in. It's like 6:30. Like I
Yeah,
slept
but
in.
you get up at like 3:30. You do your like Rocky Balboa run, and then you feed the raccoons and.
I just fed the raccoon. He comes like around 4 p.m. I get up at 5 every day when on work days, and so yeah, I'm out the house by 6. We start at 7.
Yeah, that's why you're starting at 7. What time do you usually start work in the morning?
Mondays I start at 9. Tuesdays I start at 9. Wednesdays I start at 8. Thursdays I can start anywhere from 9 to 10. Fridays I work at one office at 8 a.m. and then a different office at 12. And then Saturdays 9, Sundays 8.
You work a lot.
Yeah, I know. This summer I'm gonna like cut down a little bit.
Yeah, you take like a day off or two in the summer, man. I would.
Yeah,
do that.
100%.
Just one day, the whole summer. Just take one
Toronto
day.
summers are nice.
We've had one of the worst winters this year. So like I might take 2 months off in the summer. Like it's insane. It was raining, ice rain, hail, and then 15 centimeters of snow today.
Yeah, we just had hail, but it wasn't a lot.
That's a lot. That's a lot. Do you guys like the snow? No?
I went to grab a cup of coffee in between patients. I stepped out of the office. Obviously, I hadn't realized how much it had snowed or hailed beforehand. I put one foot out and I'm like knee deep in a puddle of ice water mixed with salt, mixed with mud. And then I had to work with that foot the whole day with a wet socks.
Hey, you know, I also just heard the echo again right there.
I'm hearing it now too.
All right, so something's. You hear that? Could it be me?
Hey guys, you still hear it?
Yeah,
Better.
we're wondering if it's someone else.
Is it me?
Was it there when I was gone?
How about
It
we
was
all,
for a second there.
How about we all take a turn logging or muting our mics and seeing if it goes away? I'll mute mine first and see if it's gone.
This is great content.
All right, you're muted first. I say something.
I don't hear it.
Serv, you got to go now. No, you got to talk now while he's muted.
I muted my mic, but now I'm good.
I still hear it when I talk.
I heard it there too.
Oh my god.
Okay. Wait. So
I've got two cell phones.
Can you mute, Serv?
Brendan, can you hear me?
Oh, it's
I hear you
Serv.
fine.
It's Serv.
It's
Holy
Serv.
sh! Yep. We
my God.
figured it out.
Why? How's it me? Let me see here.
The most professional podcaster amongst us.
That's
He's
right.
the one causing the echo
I don't get it.
with his $100,000.
But I only hear it when I'm
studio.
talking though. I don't hear it when Amir's talking or Brendan's talking.
Because Serv is now muted.
Really?
Yeah.
No, I don't hear anything now.
All this time.
Dang you, Serv.
Oh, I guess
I'm gonna log out and log back in.
You got two salt lamps? Maybe that's why. All right, now that we're echoless.
I felt bad. I was running up and down to my garage looking for my work cell phone, and it's all good.
Okay, Joe. Now I think
Work
the viewers
cell
want to
phone.
know this. How many burner phones do you have?
I mean, this is my work phone, so really one.
Is it better?
Why do you keep
his
your work
work
phones
cell
in the garage?
It was in the car actually, because I thought it was 9:15 Eastern, so I got home from the gym and I just ran upstairs and I left everything in my car. Yeah, so that's the story.
Serv, are you unmuted?
Yeah, I'm unmuted. Is it better?
Yeah, it is.
It's great.
Yeah, I don't know. Maybe it was a weird glitch.
Oh my God.
We're good. We're solid.
But that was a good 18 minutes.
Were we recording during this whole time?
Yeah.
Got it.
Serv,
Brendan, my question is, are you still at the office?
me?
Yeah.
No, I'm home. I'm home now.
Oh, nice. Okay.
I like how we all just blame Joe though,
I blame myself.
because you have the most ratchet view there of your phone.
Hold
Your
on.
audio was good.
Go. I got some background now. See that guy? I got the elf.
So what?
Museum.
Let's rip some topics. All right. I'm
Let's
sure
do it.
listeners would probably. We were at what topic were we at last time? Do you guys remember? Or do you want me to begin?
So I got some questions on like, how do you? I think we might have talked about this last time, like disto-angular teeth.
Yeah, we
I
did.
keep
talk
getting
about that
questions on vertical impactions and disto-angular impactions. Maybe we should talk about vertical and then disto-angular. Like, what do you guys do? Or what's funny is today, like, I made a point because I had a case. Both were really horizontal, deep impactions, right up against like the apex of the second molar, basically, like deep horizontally, in like a 23 or 24-year-old, so fully developed teeth. And I was like, I'm gonna do this case and record it. And then on one side, I'm gonna do a horizontal crown section. On one side, I'm gonna do a buccolingual section and see. Because I always get these questions like, why didn't you horizontally section it? Why didn't you do? I'm like, I can't do both, right? So I can do one or the other. And I do buccolingual sections a lot of times. So I tried to do on the one side, I did a buccolingual section of the crown and the root. And then I ended up having to section those crown pieces off anyways, just because it was so wedged in. And then I got that out just fine. And then on the other side, I'm like, I'm gonna do horizontal section of the crown on this side. So I did it, and I didn't section horizontally as far down the crown as I should have, or as probably as I could have. And so like I got the top portion of the crown out. It took a while to get that little piece out. And then it was still just, I still had to like section more. So I didn't do it the way I wanted to. So I kind of messed it up a little bit, but they still came out just fine. There was nothing wrong with the surgery. It's just for the recording, I wanted to do it a certain way. And, you know, sometimes teeth make you do something different, right? So, but I made a point. I'll see how it comes out in the video, but I try to do it two different ways just because I get the questions. Why didn't you do it this way? But yeah, so I don't know. I thought it was kind of funny. But yeah,
Do you
I
ever-
normally buccolingual section them and then end up taking the crown off anyways. So I don't know. Because I have a straight handpiece. That's the other thing. I use a straight handpiece. I don't have the contra angle. And so when you're working with what you guys work with a lot, which is those contra angle ones, it's different. Like there's different, I have to go in with a straight. And so it makes my angles different.
Yeah.
So that's the other thing.
Hey, when you're recording your video, Serv, do you ever abort? I mean, if it's taking too long, you
Yeah.
tell your videographer, that's it?
No, I'm the videographer.
Oh, is that right? Okay.
I record everything myself and
I
then
gotcha.
edit everything myself. Oh no, it's a head camera, right? But it's like, yeah, right. My third hand. No, I wear a head camera, but all the time. Like it's just sometimes I'm like, yeah, there's no way I'm gonna record this. And like,
Yeah.
it's like it's off. I'm like, there's no way. Yeah, that
Right.
happens a lot. That happens a lot. But what happens more often is like I'll record something, like I'm doing a procedure and I'll record it and I go back and review it. And the whole time like the focus was off or the camera was misangled because it's on my head. I don't see what I'm recording ever. I have an idea where the viewpoint is because I've done it so many times. But sometimes if it's off a little bit and tilted, then it just screws the whole thing. I can't use it. So it happens frequently.
The AI or the algorithm is starting to give you the sensitive filter, even with your like trying to filter out the reds, Serv.
On where? TikTok?
On the last couple of videos you've done, it's gotten the sensitive filter. So I'm just thinking maybe you should pivot to like red. I mean, just full blown, authentic.
You mean on
give us
Instagram?
Blood.
On Instagram? I don't black those out though. Those are all full color. I think it happens more with the collabs. Like I feel like when I do it on my own, it's different. So I don't know.
I think someone reports it.
You think so?
I was talking to Jason Arabak about that too. Like he was like, yeah, someone could report a video from like a year ago, and then like it's just weird stuff like that happens. It's ridiculous.
I think with certain hashtags, if you use and it shows up on those hashtags, people sometimes will just report it as like violence or sensitive content.
What a bunch of weenies.
I mean, really.
Oh, Instagram really kind of sucks for this stuff now. I've only been on it for like 5 years, but it's gone downhill even since then for this kind of stuff. Like this kind of stuff, meaning like surgical content.
But you know what? I think the carousels are doing a lot better than Reels. Reels don't do well anymore. Like, especially for surgical content. I think our last one, got like 50, 60,000 views. But the carousels are all getting over 1 million views.
Yeah, the last few carousels I did, I think one got like 700,000. One, I don't know, but yeah, they get more views. That's why what I do now is like I do the carousels for instead of reels, if for something over a minute, for sure, and then and I direct them back to the YouTube because I'm like, if you want the full video, go to the YouTube because I put the carousel on Instagram. And it's like a little carrot for people that want to just see it without having to, fast forward to the next one. They want the full video. So I'm like, just go to YouTube for that. Just another way to get people to YouTube.
It's a good idea.
You know what I mean? Like it's just easier for people to find stuff on YouTube. Like if you're looking for a certain case because there's playlists, it's just easier. Instagram is so random. You got to keep scrolling down someone's feed. No one really does that. So, it's a pain in the butt. It has to load before it can let you do it again. And it's just a pain in the butt.
Yeah. Sir, forgive me. You were saying a buccolingual split when you're talking about the straight hand piece. What was the other one?
Just a horizontal crown section. Section the crown off completely first and then work
like the
on
cornectomy section.
Yeah. And then buccolingual section the roots or something.
Buccolingual section of the roots.
Just take the crown off like a muffin top and then just work on and section the roots.
Section the roots separately after. Okay.
So first take the crown completely off, and then maybe at the CEJ if you can or something, and then get the roots out section. I try to do it that way, but I section the crown off, but not close to the CEJ, like pretty high up on the mid facial of the crown, and left too much. And so then I tried to elevate that section coronal piece off, and it just took too long. I'm like, this is not going to look good on video. Like it's just taking me too long. And like I had to section that cut off crown piece some more just to even get it out. So I mean, it's fine. I'll keep it in there. It's just that's what I did. I was trying to make a point. Like, let me try it this way, but I was like 4 millimeters too high on my horizontal crown section. I mean, the whole case took like 15 minutes, but no one's going to watch a 15-minute video, so you have to edit it down and That's me looking away, getting an instrument. Like you have to take those parts out. That's really annoying.
Yeah. That makes
What about
sense.
vertical impactions? What do you guys do? Like anything differently? Just buccal chops super deep based on your CT or imaging?
Vertical impactions just kind of like standing straight up like this.
Yeah, straight up, but way down in the mandible. Like, further down in the mandible. Some of those are tricky. They're just wedged in too.
For me, it's how old the patient is. If it's a patient over 30, I won't decoronate it. I'll do everything in my power to keep that crown on the tube.
You need some leverage for
Exactly.
elevation. Yeah, that's like last resort.
If it's a 19-year-old, I'll just decoronate and then create a purchase point on the roots and then just lift it up with the crier.
I got to use criers more. I haven't used them in a long time. I keep forgetting about them.
I actually had to pull out criers yesterday for the first time in a long time.
Yeah, I keep forgetting that they're a thing.
Serv, I think that would be a nice series you can do is the instrumentation, like front and center a crier, and then that how its application, and then use like an east-west, any sort of flag elevator. I think that would be helpful. Just the different east-west type elevators with pictures of them.
I don't even use them that much. You guys use them more?
Here's some east-west. You guys call them crier? I usually just call it east-west.
I call them either or.
East-west. Are
you thinking flags?
Yeah, I call east-west flags. They look like flags, but they can have a long head or a shorter head, but different lengths. Crier that's a nice looking instrument as well. But I agree with you, Serv. I should, using that more, I think is a good idea.
Yeah, they're not in our basic extraction tray, so I always kind of forget we have those things.
I had a case this week, or actually no, it was yesterday, a horizontal impaction, and I looked at the pan, looked pretty straightforward. I budgeted about 7 minutes for the whole procedure, and then I get in there and I trough the bone. I'm not joking. The tooth was all in the lingual. Like, it was fully within the lingual. So trying to extend, I was using the high speed contra angles like Joe has, trying to extend that burr deep enough to be able to section the crown off. I had tears coming out of my eyes.
Was it a long burr or regular?
It wasn't a regular burr, but it wasn't long enough. Let's just say that.
Yeah. Sometimes you can cheat and kind of sneak them out a little bit more, but then you might get some of that whipping.
Yeah. And then, you know what happened was, I remembered Joe's story because I sectioned the crown off. And keep in mind, I'm working completely in the dark. It's all with like tactile sensation. You can't see anything in there. And I sectioned the crown off. The lingual portion of the crown stayed intact. A procedure that was supposed to take me 7 minutes ended up taking me almost 40 minutes. Because now the roots won't elevate because you've got that chunk of the lingual portion of the crown against the lingual plate. And the majority of the tooth is, the actual crown is tilted towards the lingual.
And what was the reason to take the tooth out, you think? Sometimes when I see it and it's that lingual and there's no pathology, I've done a few cases where like, I don't know, what's the risk reward for taking that out? Just kind of sometimes even with the palate ones, sometimes I leave them because I feel like they're too far towards the palate. I'm like, for me, it's like, why, at that point. So I don't know.
So this patient, actually, we decided last year because both of their lower wisdom teeth was very deeply impacted. And I advised against it. I said, let's leave it. And then the patient started getting symptoms with the lower left one. We sent it for a CB, and they said it is causing a bit of resorption on the distal of the 7 on the root. So they advised to take it out. And unfortunately, she couldn't afford to do it with sedation with an OMS. So I said, yeah, that's fine. I'll do it under local, but it's not going to be the most comfortable procedure for you. Let's just say it was more uncomfortable for me than it was for the patient.
Yeah, Joe was talking about that a while ago. Like he was doing a case, kid up a dentist, and it's just looks like easy on the x-ray, and the dentist is watching and just taking longer than it should, and that kind of stuff happens all the time.
Amir, with those cases, it doesn't even have to be the entire lingual portion of the tooth. It can be a sliver.
It was a thin little piece
of sliver. It can be little. Yeah, you just have, and that's the limitation of the handpiece I use is getting that far in. You just score it, kind of crack it, and try to remove that piece, and the whole thing comes out really easy.
But here's the
But
question: how do you crack it?
Do you have osteotomes?
no. I mean, if you just if it's shaped like this, okay, or like that, you just get your 8 round with your handpiece and like drill just so, like in the base. You don't have to go the entire length. Just drill. Just be careful not to go all the way through, and you get the end of like a straight elevator, and you crack it, and that should take the whole thing out. So you don't have to go the entire length, just enough to, just to break it,
Well,
to section it.
My personal problem with this case was there was less than a millimeter thickness of
Yeah,
the enamel left, and that was preventing the roots from turning out. So I couldn't elevate the roots. Now, when you've got that thin of an enamel and you're using a high-speed handpiece, it takes very little to penetrate
yeah,
through.
yeah,
So,
yeah. That's no doubt about it.
and then when you get the blood coming through, then you can't even see.
Yeah, yeah. That's.
That's
I
the
do
other
want to tell
thing.
you. I want to tell you a bleeding story when we get to it.
When we're gonna get to it. Let's get to it.
We're here.
We're here.
Man,
Let's
so-
get it going.
I thought I've seen everything in my life. I mean, I thought I've seen everything. I've been practicing for over 20 years, 25 years. And so I get this guy, he comes in, easy enough looking teeth. Thank God, it was a local anesthetic, cash paying patient, didn't want sedation. I said, okay, so that saved my, so I'm taking out number 32, pretty conventional school on the way it should go, section the tooth. Bang, all of a sudden there's just blood. I mean, just fills up the mouth. And I've seen this before. I'm like, oh yeah, I got this. So I'm applying pressure, and it was like filling up, like back to back to back. It wasn't. I mean, I panicked, and that never happens. And thank God the patient was awake. But one thing I learned is I don't care how strong you are applying that pressure. When I kind of thought through it, just some clarity, I put the gauze in there too thick, and I told them to bite. And the pressure that the patient puts on the site is way more than you can do with your arm, your wrist, whatever the case may be. And after that, it stopped. But it took a good 10 minutes. I was thinking about taking him to the emergency room.
Bone
But
wax.
anyways,
Bone wax.
I ended up using bone wax. I tried everything, sir. I did.
You got to stuff the whole wad of wax in that socket, the complete socket, the whole thing. Burnish it with your thumb. Get in there. If there's no way for the blood to come out of that socket, that's what you need.
Yeah.
So that's what I do.
But I think the tough part with the bone wax is trying to slow down the bleed first enough to the point where you can get the bone wax.
That's why
That was my problem.
you just got to mash it in with your fingers.
Or maybe put a wad in there and have them bite down. But anyways, if you ever get into a dilemma like that, the patient's forces of mastication way stronger than your arm or wrist or forearm.
It's possible, but not all patients are compliant like that.
Yeah. Oh,
and when they're numb, sometimes it's hard for them to tell how much pressure they're biting with. And so there's some, patients, when they call me at night when I'm on call and they say I'm still bleeding, I'm like, well, what are you doing? Well, I'm biting on gauze. I'm like, is there even an opposing tooth? Like if you're taking out wisdom teeth, there may not even be an opposing tooth. So they're just putting gauze in there and biting down. There's really not a lot of pressure there. I always tell them, don't bite on it. You need to hold it there. And that stops it like 95% of the time. Like them actually holding the gauze for 10 minutes without, peaking, or good 10 minutes of pressure, and that stops it. I feel like when you tell them to bite on it, they're not doing it right, or the pressure, there's no opposing tooth really, because maybe you took out the opposing tooth. But yeah, so. I have a couple of those bleeding cases I've posted that just, happen, and I've used bone wax on them and it works really well. That way you don't have to hold anything there. You just put the wax in. They don't have to bite down. It's nice. And it stops it within a minute.
I've had a few of those before. And one thing I've noticed that helped me a lot with the pressure part is I get a curved hemostat and I get a 4x4 gauze. I wrap and lock the hemostat on top of the 4x4 gauze. And then I take that metal and then I press it hard into the socket with the gauze in the tip. And you could put a lot of pressure with that. And if you soak it with some epi, it speeds things up a lot.
Right.
Just launch some epi in there. I always liked in the ED. I always like topical thrombin for the bleeding. Just like not in the middle of the case, but for the bleeders, that come into the ED when I was on call. Just topical thrombin, throw it on some gauze, and then just hold it down there. I would tell them to bite, but I would tell them don't let up. No talking, no chewing that gauze, because you always have the non-compliant patients that just don't want to listen. They want to be dicking around with it. But yeah, I like the topical thrombin for that. But I don't even think we have it in our office now.
It's expensive. That's why it's in the hospital.
Makes sense. It works.
Yeah.
Got me through for you. What do you got over there? Is that wine? What do you got over there?
It's sparkling water with a little bit of Campari in it,
No, all right.
just to clean the palate,
No.
Yeah, it's to cleanse the palate a little bit. You've been working. What are you on day 36 now in a row?
I actually had a long weekend. I worked 30 days. No, I worked 27 days straight, and then I had a long weekend, which was like 2 days off. But like they all take it.
Do you have time to work out?
I work out every day. If I
You
don't,
do?
I
Good.
can't work. Yeah.
I was going to say, good. Nice.
When you work out, then if you're working every day, you're on the podcast now. When do you work out?
Between 6 a.m. to about 7:30, depending on the day.
Gym or in house?
No gym.
I thought you said you got up at 7:30.
Oh, today I was starting a little bit late. No, today I left the house at 7:30,
Okay.
but I did skip the gym today, which reminds me.
Yeah,
got
so did
someone
I, because
submitted-
I'm working. I'm doing this podcast.
I got someone submitted difficult cases as far as the anesthesia goes, as well. Someone submitted for a podcast to discuss.
Are they talking local anesthesia or general or like IV sedation?
Just as anesthesia. Just what's your head tricks? Patient can't get numb. You've given. I don't know. Set the tone. What do you guys? What was the last time you had a case that your patient keeps saying? What did you do? What did you do about it?
I had one today.
My trick.
Go ahead, Joe.
So my trick is if I'm like on a lower wisdom tooth, if I've given them everything I can give them, and they're still feeling it, and I believe them, a lot of times I'll know whether or not they feel pain or pressure. I'll just take a minute, even though they feel it. I'll go through that cortical bone and give an intraosseous injection, and you just get that 27 gauge, and as soon as you feel it stick into the cancellous bone, you inject, and profound anesthesia. They won't feel a thing after that. Yeah.
I like
Always. It's
PDL space. What do you mean in the cortical bone?
PDL space is good too. Like when you're troughing, you trough around that wisdom tooth, but you get through the cortical bone into the more medullary bone, where it's a little softer, and then when you put your needle in there, you can actually feel it engage, and then you hit it.
So you've troughed already at some point, and there's still feeling.
Yes, exactly right.
Yeah. I
So
see.
just and sometimes I know they're feeling it. So I use a 8-round burr. I'll go right through the cortex, just 8-round burr diameter, just enough for my needle, and I'll put that in there, and then inject some more, and profound. Yeah. So just drill. They might feel it for a second, but as soon as you get it in there, to me, it works almost 100% of the time.
I like that. Serv, you were going to say one too?
Yeah, I had one today. It was just I think it was a number, it was this lower left second molar, and it had a periapical lucency, long roots that kind of met at the apex, and didn't look that bad on an x-ray. Like, when you have a little lucency around those roots, it's like, oh, you feel good about it, right? And so I was like, yeah, and it was my last case before I had to go to UW to teach. And, like literally, like, I think it started like at 11. I was supposed to get out by 12 or before that, so I can drive down there by 1. And local anesthesia, I did a block, and I usually use like lidocaine 100,000, and then I use one Marcaine 1 to 200,000 for my blocks. I do both. And then I save the third carpule for infiltration, and then I keep half a carpule there after that in case I need it for something, And then I did that, and her lip was numb, her tongue, half the tongue was numb, everything worked, but start to elevate and stuff, and she's still starting to feel it. And so I'm like, all right, well, let me do some PDLs. So I did some PDL injections. Same thing. She's still starting to feel it. And then I did kind of what Joe said. And because it was back there, and I was able to get into the bone a little bit and inject around there. And that helped. It got it to where it was, I felt like probably 95%, like she wasn't really noticing it. When I did that, I was able to section the tooth enough to get deep down through there, and then I injected more, and then that was fine. But this took a while. Like, it took me about, 5-10 minutes even just to get really going on that tooth. So That's after
Do you
the
have an
block took
audience?
effect. What was that?
Do you, are dental students watching this happen? Or
No,
do
this
you
is
have
at my
a?
office. This is at my office.
Oh, I see.
I was
Okay.
trying to get it. This is the last
before.
case of the morning before I drive down to teach at the University of Washington. So
Okay,
it just took me a
gotcha.
while to get it done because the anesthesia wasn't working, as fast as I want it. So
I think I hear a hungry cat in the background.
Come here, bud.
I
So loud.
like those things.
There you go.
What do you guys use for say a lower mandibular wisdom tooth? Say mandibular wisdom tooth block 32. What's your go-to for that tooth when you guys are going to take it out to set the scene? You know what I mean? Because we got to have a baseline.
Like a local anesthesia?
Yeah, you know what? Why don't we all go through what our blocks are? Say a lower block.
Yeah,
Say
I do.
we're going for number 32. What's your sequence right there for that one?
Yeah, I
tooth?
do an IA block with lidocaine and 1 to 100,000 epi, 1 carpule. And then my second carpule is Marcaine, 1 to 200,000. I do another block. And with that block, I come out more halfway and I inject more of that as I'm coming out with both of them. But with the Marcaine, I do it a little bit more as I'm coming out. And then at the third I use 3 carpules usually for a lower tooth, almost 3. And so like the third carpule I do a direct lingual block, even though you're supposed to get lingual with your blocks. Oftentimes it doesn't work. And I found because when you go into that lingual, it still hurts. I'm like, that tissue is still not numb. And so if that's the case, I'm like, yeah, I'll definitely do that. So I go in to the wisdom tooth space or just distal to the wisdom tooth. And I go in about 4 millimeters or so, or even more sometimes, but I'll slowly inject a little bit there. And that gets that lingual nerve like 100% of the time. And then I'll do some buccal infiltration, which actually helps with hemostasis is mostly why I do it, and long buccal and stuff. And then I have a half a carpule left for if I need it intraoperatively. That's typically what I do for a lower wisdom tooth.
And what was that third one that you just mentioned?
Which one?
So you said 1 full carpule lidocaine, 1 full carpule Marcaine.
The third one, a direct lingual block, lingual nerve block.
Like with what? Was it lidocaine, Marcaine?
Lidocaine. Yeah, sorry. Yeah, lidocaine.
That's what. Okay.
Yeah, 2 lidocaines and 1 Marcaine is typically what I use. I rarely use articaine. I know some people use it a lot. I rarely use it.
Amir, what about you? Let's go around the horn.
Usually I do 1 block with Lido with 1 and 1K adrenaline. And then I'll do 1 block with 3% mepivacaine plain. And then I will do half a carpool of articaine with 1 and 100K as infiltrations around the tooth for hemostasis. And a lot of times it gets that, like any accessory nerves and stuff that might be coming to the tooth as well.
That's similar to Auerbach's. Yeah. He was saying he does a full with carbocaine. Yeah.
And if I get like a heavy marijuana smoker, like the ones that are like smoke 6 joints a day and nothing seems to like work on them, I'll do a block with articaine.
Interesting. Joe, what about you?
Similar to Serv's, I'll start with a block, an IA with lidocaine 2% with epi 1 to 100,000. After that, I'll do an infiltration with articaine, just all the way around the tooth, and I'll aim for the long buccal with the articaine. And third, I'll use a half carpule. If I'm doing both lower wisdom teeth, I'll do a half carpule of Marcaine as an inferior alveolar, and then get the, like Serv said, do a lingual infiltration, like directly into the lingual, and that usually will get it. So about 2.5 carpules per lower wisdom tooth.
2.5. Okay. So wait, but 2 of lidocaine. No.
1 lidocaine, 1 articaine, and then a half of a Marcaine. And I'll do the other half on the other side. But if I'm just doing 1 wisdom tooth just on the left, I'll give the entire Marcaine on that tooth.
Yeah, top it off. Why not?
Yeah, why not?
So are you giving articaine solely as infiltrations, or were you giving the block?
No, just as infiltrations.
And then the Marcaine is the other block.
The Marcaine.
The Marcaine. I'm sorry, Marcaine was the other block.
Yeah, Marcaine was the second block, and the first block was a lidocaine.
Got it. Got it.
So I'll use all 3 for a lower wisdom tooth.
But it comes out to like 2.5. Yeah, usually.
Yeah, exactly.
I like that. I'm kind of like that. I wish I used the Marcaine more often. That's a good one. I don't know why. I don't know. They just don't throw it on the tray. So I do 2 carpules for blocks or 1.5. But recently I'm doing just 2 lidocaine carpules with epinephrine, obviously. for blocks, and then I give half a carpule of septo, and I split that carpule with the other side for local infiltrations around the wisdom tooth, and I like to go a little bit further along the distal of that third molar serve, like you were saying, hit the lingual, and Joe did too. I like that. Yeah.
I used to use Marcaine on all 4 teeth. Donor, you know that's expensive. Marcaine is really expensive. I went to go see Dan Holtzclaw work one week. He was on your podcast, wasn't he, Brendan?
Yeah.
He actually bailed me out on the case, but anyways, that's a different story. So I went to Texas and spent a day with him. That at the time, this is before he sold his practice, that he was exclusively using Marcaine. I'm not sure if he mentioned that to you, but that's all he uses. I'm thinking, high dollar, upscale for sure. But I just use it for the bottoms. I don't use them for the tops anymore. Top wisdom teeth.
I thought it never really worked. Only works longer as a block. That's what I perceived. Like it doesn't do much.
Is that right?
That's what I always perceive. Like Marcaine for infiltration doesn't really add much. If you use it as a block, it does.
It gives you soft tissue anesthesia for long time.
Do you guys use Exparel ever?
We don't have it in Canada.
I've never used it. I mean, I'm curious about it actually. People advertise that they use it. They charge a ton for it because you buy a bottle of Exparel. I think it's like $200 to $300 for, and it's not a multi-use bottle. You have, so some people charge per quadrant for it. But I was curious if you guys use it.
No, never used it.
Office, but it's like I can't get a patient to pay for it. Yeah.
I was curious to see because I was thinking like for full mouth patients, full mouth extractions, all on X, I think it'd be, if it works, I mean, I think it'd be reasonable because those are the patients that you're doing a ton of work on and you just inject it into tissues afterwards and supposedly it helps with pain control for a few days. But I'm just curious to see if it actually does that.
I had Anish Gupta, Lion Dental Implants Instagram account. This one, I just was chatting with him last week actually with the Lion thing, and he has Exparel. He's a fee for service in Michigan, and he uses that, and he says it's usually after 2 to 3 days patients will call in the office, and that's when they're having some pain or changes. He says it's like nothing, but he asks them to call him when it finally starts to kick in. He was saying 2 to 3 days, so it works. Yeah,
I'm looking into trying some cases with it, but looking at different ways to do it. Wonder if you put some on collagen and put it in a socket, does that also help? Also injecting the soft tissues, but I'm just curious.
It's a good question. And what causes it to prolong again? Was it the sodium or calcium channels, or was it actually? I
don't know I haven't read up on the actual mechanism how this works is like it's supposed to work. I'm just curious clinically if like with mucosa, how it works versus skin or something, But yeah. But I don't know. I'm still looking into it.
That's good stuff. You guys have any for the patients that don't get numb very quickly? I'm big on Articaine. I try and get the PDL injections, and if the tooth's already sectioned or open or something, I try and really get it into the pulp or into one of the canals down there. That always works. That's if the tooth's already open. Otherwise, PDLs, and then that sneaky little lingual nerve. That one. Sneaky little thing over there.
It's like a cheat code, that little injection. It is tender. Like even when you're doing locals, I always tell them, you're going to feel, this is a different spot. You're going to feel a pinch and it'll get better really quickly. So you do warn them because it is tender spot, but it really helps like quite a bit. Like their whole tongue on that side, just right away, it's pretty numb. And when you go in there and it hurts, I'm like, well, that tissue is not numb either. So, I mean, it's just makes me feel better in a way that, I'm getting more anesthesia around that tooth. So.
I like that one too. Let's hit on, what do you think? One more topic?
Have you guys ever used Dex injections around the site?
Just IV.
Because I've seen some surgeons actually do Dex injections around the flap after they've closed it up. No, never?
Mm-mm.
For post-op pain control?
Yeah. It was weird. I had never seen it. It was the first time I had seen it.
That's new to me.
I saw it once. I don't know how effective it is, though. I don't know.
Well, about your post the other day, Brennan, exposing bonds, the bond debonding. What's your, Joe, you've been working the longest. What's your go-to for exposing bonds, your protocol? Just curious.
Well, I take a CBCT and...
like the glue part. The bond
glue,
part.
I actually got that from Jason.
Oh, yeah? What do you use? Use?
I forget the product, but I ordered exactly what he recommended.
Yeah.
and I tried it. I didn't like it. He likes the really viscous consistency.
Yeah.
That didn't really work for me, so I stepped it up to a little less viscous, more just less viscous, and that's been perfect.
What
That's
is
been
it?
perfect.
How do you just put it on? It's just like a cement, or you have to use a primer?
It's cure. It's light cure.
Yeah.
So I used
It's
to
not
use this
Heliobond or anything, is it?
I don't know the name, but I can
Okay.
get that to you.
Okay, here it is.
But it's all about access. A dry field. You do the acid etch for 15 seconds. My assistant is a former ortho assistant, so that's so big. She knows how to do everything. And then I prime it. I used to skip the priming step, but I don't anymore. And you've got to cure that. And then just I'm holding the bracket. They put the glue on it. I apply it, freeze. Apply pressure, freeze, and cure it for about a minute. So
That's a lot.
I've made every mistake in the world. It took me, I don't even know how long to realize that sometimes the overhead lights cure the glue. Yeah, I mean,
you have to let your assistants know that too. Sometimes you just put it in a little dapping dish and it just sits there for a little while.
Exactly. Yeah. So, but anyways, that's pretty much it. I open the tissue. Some people will burn a hole in the palatal gingiva and look for the tooth. I'll do the open technique where I'll flap it back and then bond it and then close it over the chain.
Dude,
I do that one too. Ooh, this cat's getting curious. We got a fifth podcast member.
He's just freaking. He just likes company. He's like a little dog. He's a little dog, really.
But Joe, you're doing the prime bond before, so your acid etch, prime bond, cure it, and then the new goop, whatever. Then you're curing it a second time.
Yeah,
that's a long case.
Kind of, but it really takes about 10 seconds for it to cure. And then I don't even check to see if the primer's cure, and then I get the cement and put it on the bracket, and then put the bracket and the chain on the tooth. Sometimes if I try that twice and it doesn't work, right onto the tooth, it kind of like a little mountain of glue, and I'll stick the chain on there. And orthodontists probably don't like it, but sorry, it's probably not clean, but it'll work.
I do the same thing, just not with the prime bond. I just go acid etch, and then we have this like hydrophilic but light cure. I guess it's a glass ionomer. Just stick that on there. It does a good job. What do you guys? Well, Amir and Serv, I want to hear your thing, but what do you guys do for bleeding also in that area?
You can use epicord's ferric sulfate. Sometimes I've even used tranexamic acid for bleeding. You can use your epi in your local.
That's what I do. Yeah.
We have this ferric sulfate gel. It just really good. It just kind of almost chemically burns the area, and so just stops all the bleeding. Looks kind of black, but you can use silver nitrate sticks. We have those too. So little local measures like that are pretty effective. That nitrostat or whatever, that ferric sulfate stuff is really cheap, and it works really fast. So that's really good.
I think the trade name for it is called the viscostat.
Yeah.
Joe, what about you? You use that too for and I'm saying just like around the tooth if the blood's like seeping into your area.
You're talking with an exposing bond? I've got a little cautery. I'll just burn it. I'll just fry the little bleeders, and then I've got my girls. They cut the 4x4 gauze into strips, and I'll pack under the lap with the strips and isolate it.
That's
as
a good
much as
idea.
possible.
That's a good idea.
Yeah.
Sometimes they use cotton swabs, and I don't feel like that does enough because it just rebleeds really quickly.
Messy. Yeah, cotton's messy. If you cut them into strips about like that, and you just
pack them in like a cord.
Pack them in. Yeah.
Just make sure you take them out. But yeah.
Exactly. So usually after I acid etch, I'll take everything out, make everything dry and fresh, air, that sort of thing. I never put air directly on the tooth. I'm reflecting it with the Minnesota, and I'll blow the air on the Minnesota.
Do you have
an
air thing like a dentist does?
Yeah.
You do?
I do.
We don't have that.
Well, you look at my handpiece, it hooks up to a general dental type air driven.
Yeah, I don't have anything. Unit. You know what I used to do that? This old school like bulb with a little metal thing, and I just have to like the blood pressure cuff. Like that's what I use. It's so ghetto, but we don't have the air thing. And it's that's what I use. It's so ratchet. I have a video of me using it. I think I did a case a couple weeks ago. I gotta show that. But I did the mistake once. I'm like, wonder what the air smells like, and I like smell the air. I'm like, but it's just like an air, that, and it sucks because when you're pumping it so fast, like that little metal part moves around a lot because it's just a little bulb. So you have to like hold that and like
You know what? In
Oh.
Australia, in the OR, because they didn't have anything like any compressors for air and stuff, they used the monojet. So they kept doing this.
Oh my God. I love it.
Yeah, I guess you could use like a
I love
60
that.
cc Toomey syringe or something and just kind of keep. Yeah, that's true.
Right.
I mean, just do one of these.
Oh my goodness.
Yeah, that's what I use. It's pretty bad. We don't have the air things. You know, gotta do what you gotta do.
What do you have a record, not a good record, but a record as far as how many times it took you to get one to bond and stick? Have you ever just aborted and just say,
Yeah.
I can't do this? You have?
Sometimes we go. I've been practicing 16 years. I've probably had a case where I've had to glue 5 different times during the case, and it just wasn't working out. And then you're like, I'm like, well, I mean, just scrape the tooth again because all that residual stuff is not,
Yeah.
it's just, then it's like, it's almost like, how are you going to get all that stuff off? Maybe just wait a while and come back and then, it'll just come off on its own. But yeah, every once in a while.
I think one time it took like 4 tries. Usually it's the max is 3. I think maybe one time it was a 4th back in residency. But Amir, you doing a lot of exposing bonds?
No, I used
You're
to
lucky.
do it. Wait,
Why not?
I don't like them.
financially, it's just not worth the time.
Well, we know that, but
Benefits of not being a specialist. I don't have to do
It's
them.
not worth my time.
I think those. Would you guys agree? Like, so whose back is not hurting right now? That's another question.
Oh my God.
It's like my neck, right here, right there.
Yeah, my back is freaking it. I look like a former NFL, those NFL players, the way they move.
Oh,
This today I was, because I went skiing this weekend and I wiped out like 10 times. And yeah, that's why I was out late. I was at the sauna trying to, loosen it up. But today was a rough day at work. I had hard wisdom teeth. God, what was the one? My first, I had an immediate implant I couldn't do, but so it was just, I was hunched over like crazy all day. And combined with wiping out like 10 times on the mountain, it was good. It's good to be home.
gotta be careful with that, Joe.
I was a little worried about it, but it wasn't too bad. I just skied on the green, like easy, but
Yeah.
I won't ice skate just for wrist purposes. I don't know a lot of oral surgeons will do that because if you hit the ice, it's trouble, But skiing, I think, is, it's powder, and I think it's
For the
calculated risk.
record, I've never ice skated.
No, okay. Amir, I know you're from Canada, right?
I have, definitely, yeah.
And you're from New York, Brendan. I'm sure you're a hockey. Do you play hockey, or were you a skater?
I played a little when I was younger, but I learned how to skate in like our camp, like summer camp. Yeah.
Yeah.
What do you guys think is the number one though for like procedure that's just a back crusher? You know what I mean? Just like put you down.
Exposing
and out.
bonds on the palate.
100%.
I remember
Oh my
once
God.
they scheduled
Yeah.
me. They did 3 of those in a row that morning, palatal ones, and some of them were like double, like both sides. I was like, "Don't ever do that again." I told who scheduled this combination of cases? I'm like, "Don't do that again. That's just too much for me."
Yeah.
Like my
How
back.
long ago was that? That's horrible.
Oh, that
3
was like 8
exposure
years. That was like 8 years ago. They haven't done that since, but it's like 3 or 4 in a row that morning. And then like go do other cases, and then like that was like the worst.
Yeah, you're exactly right. I had these twins I did last week and the week before, and they were one girl did hers on a Monday, and the other twin did it the following Monday. So I started, and they both had impacted doubles, and they were hard, and they're twins, so they're very similar, and that set the tone for the entire week. You know what I'm saying? Yeah, 100%. It was. I mean, you're hunched over for a good 45 minutes to an hour. It's brutal. So I mean, it's good. It's good to like sauna, get massages to take care of yourself, Brendan. If you're hurting already, I'm sorry to hear it, man. You're so young.
I got a ratchet sauna. I got one of those pods.
in your house?
You know those pods, like the circle?
Yeah.
They're not
you
that
can get
big.
it at Costco.
I know.
Yeah.
So I bought one online, not from Costco, and it was like 600. It was like Pod Company or something. And then like it came, and then I was at Costco the week later. And like I saw one from like Homedics for like $150. I'm like, oh, I mean, I pay like $650 for mine. It's probably the same thing. I'm like, I felt ripped off. It does work. There's not a lot of room in there, so I'm like, I literally can watch TV in there. Like I'll just sit in there, and on the gym area in my house, I can. There's a TV I can watch, so I just sit there and watch like Peaky Blinders or something.
I love it.
for 20, 30 minutes. And it's like, it works. Like it gets up to 200 degrees in there. There's a little chair, not a lot of room though. So only, not super
I would
ergonomic.
do that, but I just wouldn't be committed to cleaning the damn thing.
Yeah,
I'd
I
rather-
haven't cleaned it yet. It's been 2
Oh
weeks.
yeah. Forget it. I just got a membership up the road. I just go there. It's nice.
I mean, I put towels
People are
all
nice.
in it, so I change out the towels every day. But I haven't did a scrub of it yet.
Another hack, I think, for your back, and a lot of times it's not your back. Sometimes it's your hamstrings are tight as well, and that can make your back tight. So it's a whole list of things. I've got these lacrosse balls. I've got them in my bed, in my car. I took them on the plane, and I'll get them and I'll put them right behind my back and lean and have a massage 24 hours a day. So every chance I get, I try to, break that up a little bit, that tightness.
Yeah. I just got this contraption. It's like it's like $20 on Amazon. It's kind of like an S, and the back loop it just goes over your shoulder with a ball on. I just got that. It came in the mail 2 days ago. That's been really good. It's the ones like are you guys all righties? Actually, I don't think I've ever asked this.
I am, yeah.
You guys are all righty. Joe,
Yeah.
you righty too?
We're righty.
So so you guys all know, you would agree, it's the 1516 previously root canal treated tooth. When you're up like this, it keeps breaking down. You can't see it back there. Now you get the palatal root stuck. I'll get 3 of those cases in a row in the afternoon, and you got to move. So it's not like you're stretching out a little bit after. It's like one into the other, and you're constantly. I don't know. I've been getting a lot of those the last couple months.
Those are the cases where that's why I could use the lights like the Biolumix for me. Like I can't use them on upper left quadrant because every time I'm doing one of these, like it starts to slide away.
You don't put on a surgical cap.
No, I don't.
I don't have that problem, Serv. I use that Biolumix, and it's fine when I'm doing the number 16.
I think I have a small head, and so like it doesn't get tight enough. Pinhead.
Yeah. So the back. Yeah, I would agree. The exposed bonds are like those ones that just keep breaking down from the opposite side.
Did you ever have these conversations with your attendings, Brendan, about their back health and things like that?
A little bit, yeah. I never had issues up until this year. It's interesting. One of my attendings would sit down. He would say, I sit down for all my procedures.
I don't know if I
yet.
can remove wisdom teeth.
I think-
now.
You need to be in like a certain dental chair where you can lean the patient back perfectly. But I don't know how you would manage that with like sitting there like all cozy. Ideally, like you want to be sitting there cozy, but pushing the meds, looking at the monitors, looking here. I just feel like sitting down, like how do you reach for it?
I don't know. I've never tried. I think everyone has to be sitting though, then to make that work. Then.
Yeah, then all the assistants need to be sitting.
I don't know if you
Oh,
guys
God.
noticed, but in the last hour that I've been sitting, I've been tilting, stretch for. If I sit for more than 30 minutes, I could feel the sharp pain going from my behind all the way up to my neck.
Really? Yeah.
You're in for a treat.
I can't sit in a car more than an hour, and it's just really hard to even sit in a car. Like, it bothers me.
You got to get a car with massage seats. That's the only thing that will work.
I had one. So in 2010, I bought an E63 AMG. At the time, it was new, and it had massaging seats in it, and I just didn't do anything for me. I don't know. Maybe the technology's better now, but I don't know.
What car? Well, we don't have to go into it. You get massages on the way to and from work?
No, I
the
don't. My
car?
car doesn't have it, but honestly, last week, I'm buying one that does. I'm like in the process of trading in my car.
Really? The
Joe, you
car or
have
the
a solid
SUV?
car, right?
SUV.
I'd try to get a lacrosse ball and just literally put it behind either your lower back or your upper back and just sit there. And it feels uncomfortable for the first minute, but your muscles start to soften. And after a couple minutes, you can tell the difference. So it's not an instantaneous thing. You really have to apply pressure for a good amount of time, and then you can start to move it, and it's pretty helpful. Driving is it can be effective when you're driving too. In my
Hey,
opinion.
Joe.
So if you
Joe,
see
you did it. You
yeah.
posted a video last week on your story or something. You were working out at home, I think, or something. You had these like Sacagawea looking moccasins on. I was gonna comment and like I actually like recorded your video and I was like I went to chat and like what are these shoes about? And then like gave me 10 different like things. I'm like these are so.
Oh my
funny.
gosh!
I was gonna like start, but then I got busy. But what the hell are those shoes doing, dude?
They're they're
Those
kind
look
of like an UGG, like kind of an UGG knockoff. But what did your AI say the brand was? I'm just curious to
Oh, I
know
don't
if
know what
it,
the
if it
brand
was.
was. I just said, give me something to say about these shoes, man.
Oh,
And like,
I gotcha.
like they came up with some good ones.
Yeah,
I was
sometimes I
like,
work out my slippers. That's the best way to do it. Yeah,
yeah,
I forget. They're just these fuzzy Levi sneakers. I got them from the mall. You
yeah.
know, I used to have Uggs and but they're all the
I mean, I
same.
was working out in pajama bottoms sometimes. Like sometimes
I see that.
when I have my daughter with me, like I get up in the morning and work out before she wakes up. And so like sometimes I'm like, I just leave my pajama bottoms on. I gotta wash them anyways. And like I'm in my house, so rowing machine, lifting, my pajama bottom, like the flannel ones. But yeah, I'm at
Have you
home.
guys noticed in the gym like there's a movement now? It just seems like a trend that people are starting to work out with no shoes on. Have you guys started to see that? People are taking off their shoes, and
That's
I don't know.
nasty.
It's kind of strange,
I've
but
seen it for a while. Yeah, yeah. Some influencers are saying like it's better for your posture and your back, and doing
yeah,
barefoot and stuff.
Athlete's foot, man, big time in the gym.
Yeah, athlete's foot.
That's nasty.
yeah, yeah. So I figured the
Even
slippers are
warts. You
okay.
can get warts. You can get warts from walking in places that people with warts had. Like that's how you get them, literally.
Yeah,
So
yeah,
that's nothing and those are hard to get rid of. So yeah,
yeah.
I would not do that.
Yeah, I agree. Keep your shoes on. Keep your shoes on, everyone. All right, guys. I gotta go get dinner. I gotta get ready for tomorrow.
I gotta go work out and do my
Fellas-
ratchet sauna.
Wait, you're working out inside of the sauna?
No, that's my like break after I work out. I sit in there and watch some TV by myself, and then like I'm done. I would take a shower and it's bedtime.
Make that a story. I want to enjoy myself tonight. I want to see that.
I'll take a video from inside my sauna and post it.
Okay, I appreciate it.
All
Good
right.
stuff, man. Good stuff.
And I'll be naked
Hey, guys.
just for you, Joe.
Oh, stop,
Amazing.
please. I don't have nightmares.
I'll be thinking of you, Joe.
Oh God. Right.
So, Joe,
I'm sure.
when you're driving with that lacrosse ball, is the people next to you just watching you do this the whole time in the Cybertruck?
It might be a strange view. There's no doubt about it, for sure. But yeah, it can get kind of gnarly in there. Quite honestly, it's pretty cool. Feels good, so I don't care. Try it. You'll like it.
I don't even know where to get a lacrosse ball from.
Oh, Toronto. That's right. Yeah, you guys don't have it up there, right? You don't have lacrosse.
I don't know. I'm not huge
Play it
into
against
the sport.
sports. Yeah. I mean, they've got massage balls that are the exact same thing that are like $20, but you get lacrosse balls $2. Same thing.
I think I just have to get a Mercedes that has massage seats. That's the only option.
Right.
That's easier. That's a lot
It's
cheaper.
easier.
Yeah.
I know where to get one of those from.
I'm sure
I
you can
like
get
it.
a lacrosse ball on Amazon. Yeah.
What's for dinner, Brendan? Where are you headed?
Oh, I have these. It's called Made Meals. It's like a local, like
Meal
organic
prep?
grown stuff. I don't meal prep. I buy these meals and do 4 a week, and then I have a nice healthy meal when I get home. I don't cook.
You only eat 4 meals per week?
I buy 4 meals because Friday we'll order something, and then Saturday who knows what's going on. So 4 of the nights of the week I have these 4 meals, for dinner.
Do you guys have Core Life in New York? Have you heard of that?
Core Life.
Yeah. It's kind of like a bowl and kind of a healthy type option, but yeah, that's my new obsession. So good.
Core Life. I gotta check that out.
Yeah, good stuff. Basic bowl with quinoa, rice, beans as a base, and then pick your protein, and then veggies.
It sounds
Pretty
like a gut punch.
Might be a hot take, but I think quinoa sucks.
I hate quinoa.
Oh, really?
I tried to
Okay.
like it. I just can't.
You need to dump sauce on it. Or
Even hot
something to
sauce on
make it work.
quinoa
Yeah.
doesn't do it for me. So I don't know.
Yeah.
Have it with feta cheese, cucumbers, some peppers,
Some poutine,
some cucumbers in there.
ketchup chips on top,
Serv, I haven't had ketchup chips in many
little side of Smarties,
Smarties are
little
gross.
coffee crisp.
Hey, coffee crisps were actually delicious. How do you guys not have
Yeah.
coffee crisp in the States? That's crazy.
We don't have it.
I don't know what that is.
That's wild.
That's
Yeah.
some Canadian stuff right there.
Have a Molson.
I gotta send you guys all a pack of coffee crisps.
Send them over. I want to have that.
Yeah,
I
please
made
do.
the mistake once when I was married. My mother-in-law gave me a little coffee crisp candy bar. And when someone gives something to you like that, you're like, even if you don't like it, you're like, oh, thank you. It's great. And then she thought I liked it. And every time she came over, she had like a big bag of coffee crisps. I'm like, thank you. Like 5 years, but they're not terrible, I guess, but Not my thing.
Are they like coffee or is it something else?
It's coffee flavored chocolate wafer inside
It's so
kind
good.
of thing.
It's so
Yeah, I'm a fan. I've had that. It's good stuff.
Sounds pretty good to me.
Yeah.
I want to hear what your guys' routine, like weekdays. What are your breakfast, lunch, dinner? Do you buy lunch at work? Do you bring lunch?
I don't ever eat breakfast, and I go out for lunch pretty much every time. I don't cook either.
You go out
Yeah,
every day?
yeah.
Where are you going? You have
Wherever
time to go?
If I have time, like if I have 20 minutes, that's enough time sometimes, depending which office I'm at.
So you're going out, you're picking up, you're not going and sitting down.
Oh, no.
And then what
Sometimes
about
I don't have
dinner?
any
So
time.
you don't cook. So what are you doing for dinner?
I tried cooking a while ago with HelloFresh. I'm actually got the basics down, but then I got so busy with the podcast because I started that. And I'm like, after I started the podcast stuff, honestly, I didn't have enough time. Like, there's just not, I need to get a workout in. I need to do that. Like, there's just no time. So I'm like, I started ordering out more and, again, but we'll figure it out.
Podcasts are more important. No, you made the right choice. Amir, what about you? What do you got? What do you got during the week?
To be honest, I used to eat out every meal, breakfast, lunch, dinner, but I was very blessed for the last 2 months. My dad and his wife were here staying with me, so they were cooking me breakfast as soon as I got back from the gym. They would pack me lunch to take to work. I come home to a set dinner table. It was amazing. They left yesterday. I'm back to the junk again. Those 2 months, I had the best nutrition ever.
Oh man,
I
that sounds amazing.
I've literally tried with every one of these meal prep companies, and they all start off really great, and the ingredients are good, the food tastes good, so I used to like take those to work with me. But after a while, they all just drop so bad in quality. It's like disgusting. I'm like, I can't do this anymore. It's like prison food.
Really? Okay. What do you mean after a while? Like they change?
Yeah, I feel like the more they expand, lower the qualities come.
Okay. I thought you were saying something like you get used to it and it just but yeah,
Maybe
I know
that
what you mean.
too, but
Kind of like a DSO. No, I was kidding.
I was literally gonna say no. It sounds like that. Well, I mean it does, right? Joe, what about you?
So if I work out, sometimes I'll bring my protein powder and I'll take like a chocolate shake with water, and that'll be breakfast. Or sometimes I'll work out in the morning. And luckily, Monday, Wednesday, and Friday, the hospital where I have privileges is on the way to my office. So I'll stop by and there's always a breakfast bar, and I'll just get a tin of scrambled eggs. Just have that. So that'll just plain eggs with salt. Yeah, so either a protein shake or eggs. And same with lunch. I'll either, if I'm near that hospital, I'll just run to the hospital. Like Serv said, if I have 20 minutes, I'll just go make a plate and come back. So I take advantage of the hospital where I have privileges for food.
Hospital food.
Yeah. Well, they take care of us at HCA, so it's pretty decent.
So they have like they got good food there. It sounds like that.
Oh yeah.
You don't
Oh yeah. Some of my OR days, I look forward to it because I'm actually in the hospitals in Nashville, and I mean the food is borderline gourmet. I mean it's just like I look forward to it. It's like I get to eat at Centennial today.
do you have to pay
so
for
it's
it or
nice.
it's free?
It's free, 100% free.
Wow.
Wow.
That's crazy.
Yeah.
They don't even pay us
100%
to
free.
take call at my hospital. We have to do it.
Yeah. So today, like before I went to the sauna, I dropped by and got a banana and like a little tin of pepperonis and cheese just for some protein. And I skipped the gym because my back was tweaked. But anyways, yeah. So it's like free food. It's pretty
I think
nice.
it's those shoes that mess up your back.
You think so? Doing squats in my slippers. That could be,
those
be a
Sasquatch
factor.
moccasins.
Yeah.
Joe, do you remember 5 years ago you did a story takeover for #oral surgery? And you did like
I remember
a full 24 hours in your life?
Right.
We should do that again. I think you guys should do it. Do like a full day takeover of #oral surgery.
That's your page, isn't it?
Yeah.
Okay.
I think Brendan
I
and
remember-
Serv should do it too.
Surgical Gourmet did it, I remember. Who
My
else
day's
did it?
so
I did it.
boring.
Surgical Gourmet did it. Han did it in New Zealand. You did it. A couple of other people did it in Australia.
Yeah, that was fun. That was when I was teaching at the school, and I got to have some of the students in there, and they were excited about it.
Yeah, I remember that.
Brandon's like, that's a good idea. Oh yeah, I could do
That is a
that.
good idea.
I could do that.
That is a
Yeah.
good idea. We
Takeover,
should all
little
do that though.
takeover.
Like switch
Yeah.
up. We should do that. We should do that. Like I don't know if I can take it over. I think I'm maxed out on my account signed in, but if you tag it, it could be reposted. I'm serious.
I remember what I was doing is I was just taking these clips and sending them to Amir. I'm like,
And
you know,
then I
here's more,
posted
here's more.
it.
Yeah, I think I overwhelmed you.
Well, no,
Quite
because
honestly.
surgical gourmet. So what happened was surgical gourmet, Salib. He was trying to log into it, and because he was in California and my account was based out of Canada, Instagram logged the account for 24 hours.
Oh yeah, that's crazy.
So then I'm like, okay, for Joe's turn, why don't you guys just send me all the clips
Yeah,
of the
you have
stories
to
you're
do
taking,
that.
and then
I
I'll
literally
post it.
Yeah.
started an Instagram account for my private practice this last couple weeks, and they flagged it as spam because I followed like 10 accounts at one time. You know, I'm starting my account, followed like 10 practices in our area, and like, sorry, you can't do this anymore. And then like they couldn't use the account, and then we had to pick a different name. So
Yeah, just on that note, I used to post, you know, what I would use for IV sedation. I put the word fentanyl in there, and it banned me from having any lives for a year. I'm in prison right now because I used the word. That's why people they mark it, they white it out. So for whatever reason, that's a red flag term they don't want you to use.
You should say Fenty.
I don't know. I used to say
Sublimates.
fent, just FENT, and for whatever reason I spelled it out, and I got dinged for it.
The restrictions are crazy.
I'm telling you. Yeah.
All right, guys, I gotta go get dinner.
All right, guys.
Go.
Hey, I enjoyed it. It was wonderful.
sorry for blaming you about the echo, Joe.
Bastard. It's your fault. I felt so bad going down the stairs. I'm like, damn, I was so mad at myself, and it was your fault. All right.
All right. Good night, Jen.
All right, guys. Have a good one. We'll
Take
see you.
care.
Bye.
All right, guys, good night.